OTs have been wondering how I have been able to get so many patients on our schedule and keep my therapist busy through this crisis. If you're curious about how to get more patients onto your schedule so you can keep working as an occupational therapist in hand therapy, then keep watching. My name is Huang with Hand Therapy Secrets, and I'm going to talk to you a little bit about what we do here at my own clinic. So I have a private clinic here in Miami, Florida, and even through this crisis, we have, to be honest with you, not seen a drop in our caseload. My therapists have been so busy that they don't have the time to be off. They're probably wondering like, shoot, I should be off. Everyone else is off, but they're working and we're busier than ever before. And I'm gonna share with you why we're so busy. So one of the reasons why we're so busy is because we have communication, but we have a specific way, we're just not talking, right? We have a very specific way of how we communicate with our patients. Now, if you're an occupational therapist and you want to get into hand therapy, right, this is going to apply to you because it's so important how we communicate in a certain way so we can get that job, right? We want to talk to our potential bosses in a way that lets them know like, hey, pick me. I want to work in your hand therapy clinic, right? And if you are currently working, but maybe you've got your hours cut or you've been furloughed, what are you gonna do? What are you gonna say in order to ensure that they pick you to come back? Let's be honest. This is a crisis. Nobody has been through this before. Like nobody's been through this. It's the first time we've all been through this crisis, right? But what I do know is after a certain crisis, it's a little bit of recession, right? People are talking about potential recession going on, right? And so what's gonna happen is there's gonna be fewer jobs out there. Whatever jobs there are, I want you to be able to keep that job. I want you to get more hours. How do you get that? It's a very specific way that we communicate with our patients. And what I want to do is I'm going to include the link below. And what you can do is you can sign up for the Hand Therapy Mentorship Program. We're kicking off a call this Thursday at 7 p.m. Eastern Time, and I'm going to go and talk about communication. So communication, there's a couple, not just a couple, there's a ton of topics within communication. We're going to talk about communication at the evaluation, because one of the most important things is if a patient's coming to you, then you want to speak to them in a way that's going to make them want to come back to you, right? So in the evaluation, what are you going to say to make it clear on what's wrong, right? And then you want to create a plan, right? Create a plan. The key thing is not any plan. You want them to keep their plan and want to come back to you, right? So you need them to follow through, right? So at the evaluation, how do you get them to keep coming back to you? Create a, clear on what's wrong, create a plan for them, and then have them follow through. These are the three main areas of an evaluation, and I want to help you to be able to communicate these things really clearly. So I'm gonna kick off the call Thursday at 7 a.m. Don't listen to me. 7 p.m. Eastern Time. So the only way to come on to this kickoff call with me, it's gonna be this Thursday, right? This Thursday, what's the date? I forgot. The 14th at 7 p.m. Eastern Time. In order to get a link for this call, right? In order to come onto this particular call for free, then what you need to do is be in my free 30-day training, because I'm going to send you an invite. And if you're not in it, just join my community, Hand Therapy Secrets. Just email me and I will send you the link personally. All right, I'll see you on the call Thursday.